Hello all, welcome to yet another live session of Narayana IAS Academy. So this is Sureka Bhaskar here to present you the daily news analysis. And for this daily news analysis, we've actually picked up very important articles from both the Hindu as well as the Indian Express that become extremely important and relevant for the upcoming or the UPSC CSE examination. So let us actually kickstart our discussion with the daily motivation. So the motivation for today is something that all of us know, which says confidence is the number one secret of success. So be it any other virtue, among them all, which virtue actually holds the highest pedestal is confidence. So once you possess this particular virtue, there is nothing that you cannot change or unfold in this particular world. Okay, so this same thing applies to our UPSC preparation as well. If you actually move forward with confidence, there is nothing and no one can actually stop you from achieving success. So having said this, let us actually move forward and look at how we at Narayana IAS Academy is actually aspiring in order to make you ace this particular prelims examination 2025, or in case if actually you skip this, what happens is how we are helping you to clear this examination in the upcoming years. So for which we've actually come up with a 1-year prelims cum mains integrated course 2026 as well as a 2-year prelims cum mains integrated course for the 2027 examination. So the entire duration or the capsule, that is the entire duration of the course, is going to be 1000 plus hours, where 800 hours is actually given exclusively for your general studies as well as CSAT, as well as your remaining 200 plus hours is given for your current affairs. Okay, so here it is actually a comprehensive and a 360-degree program where it will actually cover all the 3 stages of your examination, be it your preliminary, the mains as well as the interview. Now, apart from the products or the other materials that we actually give in order to complement your process of preparation of this examination, we also provide you with a strategic micro schedule. This is nothing but a detailed day-to-day study plan where the subjects as well as the number of topics that you have to cover on a day-to-day basis is actually given to you, and this actually ensures that your progress is very steady, okay, and that you're not lost in this entire expanse of the syllabus that the UPSC gives. So all these courses or the classes are actually taken up by the expert faculty who themselves have been till the interview stage of the examination, and also in order to make you analyze or introspect your own performance, we also test you through our test series, and also accordingly we give you a personalized feedback, okay, so that you can improve when compared to that of your previous performances. Now let us quickly move forward and look at the number of topics that we've actually picked up today for discussion. So one second, just give me a minute. Okay, I'm not just able to move this cursor. No, I want to move this side. Yeah. Yeah, now let us actually continue looking at the topics that we've picked up for discussion today. So the first article has actually been picked up from page number 8 of the Hindu. This is the need for universal and equitable health coverage. Okay, so here we will be discussing about why is it important to integrate the diseases like the tuberculosis into the universal health coverage. So for that, we need to understand about what is universal health coverage. It is nothing but all the people definitely have access to the needs, okay, and whenever they need and wherever they are, whatever needs they actually have with respect to that of the health services, they have to be provided with. So this is what is called as universal health coverage. And why is it important for integrating these specific diseases like tuberculosis into the universal health coverage system? And where does actually India stand with respect to that of the universal health coverage? What are the other health parameters like the IMR, the MMR, as well as the life expectancy? And what is the progress that India has shown in achieving or eliminating the tuberculosis? Whether it is a part of India's targets of SDG or not, let us actually discuss that, okay? So here we will be discussing about the concept of universal health coverage. So what is universal health coverage? Where does India stand in it? What are the measures? 1 minute. So what are the measures that India has taken? And why is it important to integrate diseases like the tuberculosis, and how far India has progressed in eliminating this particular disease is what we'll be discussing here. So this will definitely be a main centric article. Now moving forward, the second article is also picked up from page number 8 of the Hindu, imagining a 360 and a comprehensive TB care response. Okay, so here there is actually this International TB Day. Okay, so with respect to this, there were a number of articles with respect to that of tuberculosis and what has been India's progress and strides towards eliminating tuberculosis. So since we will be discussing about tuberculosis in detail in this particular article, here we will stick to what is universal health coverage, which becomes equally important for the examination. Okay, so here we will be discussing about what is tuberculosis as a disease per se, how it is spread, what are the causes, what are the symptoms, whether there is treatment, whether it is preventive or curable, etc. will be discussed over here. And also we will look into the WHO reports as well as the the reports that have actually been given by the other international institutions. Where does India actually stand in eliminating this particular TB is what we will be discussing here. So this will be a prelims article. Now moving forward, the third article has been picked up from page number 10 of the Hindu. India imposes anti-dumping duty on 5 products from China for up to 5 years. So here you need to understand what is this particular process of dumping, whether this particular process of dumping happens with respect to or impacts negatively the country that imports or the country that exports. So all this we'll be knowing, and in order to protect or safeguard one particular or the domestic economy, whether this anti-dumping duty, that is a tariff that is actually levied on the imports, what is it, why India does it, and in what way is it going to favor India, all that we will actually see. And also what are the 5 different products that India has actually imposed anti-dumping duty from China. So this is what we will be discussing here. So here this is actually a prelim centric article, and the next article that has been taken up is from the Indian Express, page number 8, migration after COVID. So this particular article specifically talks about the transition or the shift in the migration pattern. Migration is nothing but movement of people either from rural to the urban areas or urban to the rural areas, or emigration, immigration, etc. It also includes the status of students, the urban workers, etc. So post-COVID, for the past 5 years, how has been the change in the pattern of this migration is what we will be discussing in this particular article. Okay, so now let us quickly move forward. So again, this is going to be a prelims article. After discussing all this, we will be solving a mains practice question. Followed by that, we will actually solve the MCQs corresponding to these particular topics. Okay, so now let us actually move forward and quickly start with the first article, the need for universal and equitable health coverage. Okay, so here we will actually see what has been the progress made by India in order to eliminate or reduce the intensity of the spread of this particular tuberculosis. Okay, so here how, and at the same time how it is important to include or integrate these particular diseases to The universal healthcare is what we need to see. So here we'll be discussing about universal healthcare as well as healthcare infrastructure in India. Important for both your prelims and the mains examination, and specifically for mains comes under GS paper 2, issues relating to the development and management of the social sector services relating to health, education as well as the human resources. Okay. So now let us move forward and see one of the questions that was asked in the 2015 examination, your mains exam, was the public health system has limitations in providing UHC, that is universal healthcare. Do you think that private sector can help in bridging the gap, and what viable or what are the other alternatives that do you suggest? So this was actually a question asked in your mains examination. So from this we infer that universal healthcare becomes very, very important. So this article also talks about the need for integration of tuberculosis services within the broader public health system, and this actually becomes important or key to India's pursuit of equitable universal health coverage for all. So for this we need to understand what is the, what do you mean by integration of tuberculosis into Ayushman Bharat? Okay, so before this you need to know what do you mean by the universal health coverage. This is nothing but when all people actually it means that is WHO definition of universal health coverage is that all the people have to have access to full range of quality health services they need. So also these quality health services should be provided whenever they need and from wherever they need. So this is the concept of universal health coverage. Okay. So this should be provided to the individuals without causing any kind of financial hardship. Okay. So this is what it actually says. Now let's see how has been the traditional way India has been dealing with certain diseases like tuberculosis. So India has been dealing with this tuberculosis care under vertical programs. What do you mean by vertical programs? These are specific programs which are targeted for addressing the menace of certain diseases. For example, programs for malaria, programs for dengue, then programs for tuberculosis, and these vertical programs, one of which is the National Tuberculosis Elimination Program, that is NTEP. Only via NTEP, India has been addressing this particular issue of tuberculosis care. So this has been effective, but it functions separately from the general healthcare system. So this has resulted in the gaps in accessibility to this particular care. Okay. So TB services got introduced into the Ayushman Bharat. So this is actually focusing on what? The health, right? So here what happens is that the diagnosis, the treatment, prevention are actually enabling the seamless integration into the routine healthcare system. So this is why, this is how TB actually got integrated into this Ayushman Bharat system. So here what is the role of, that is under this Ayushman Bharat, what happens is that there has been the Ayushman Arogya Mandirs that have been established. Okay, so these AAMs, they actually act as the sputum collection centers. Sputum is actually the liquid from your the mouth, okay, or you can say it is the phlegm that is collected, and here it results in quick testing as well as early diagnosis. That is, these Ayushman Arogya Mandirs under Ayushman Bharat enables quick collection. Next one, the patients, even if the patients who are actually diagnosed with tuberculosis are from the tertiary hospitals, the treatment are given at the nearby health centers under this particular Ayushman Bharat. This will eventually reduce their transportation cost and the risk of treatment dropout. Okay. Next one, the community health officers are actually appointed and they are trained to monitor the early stage TB patients as well as look at their timely hospitalization. Now moving forward, the financial or logistic challenges are minimized. Okay, so this promotes early diagnosis as well as treatment seeking behavior among the patients. Okay, so this is what is the role of Ayushman Bharat, or you can say what is the impact of integrating tuberculosis into the Ayushman Bharat. So here we already saw what is universal health coverage. This is nothing but the definition according to the WHO actually says that all the people, when they have access to full range of quality health services they need from whenever and wherever they are, without any kind of financial hardships is called as universal health coverage. Okay, so this aims at the health promotion, starting from the prevention of a disease, or in case the disease is actually diagnosed, the treatment of the disease, and after which rehabilitation as well as palliative care is also given. And also universal health coverage is recognized as a part of the goal 3.8 of the sustainable development goals. Okay, so these sustainable development goals, which are 17 in number, which deals with health, which deals with climate action, etc., is very, very important. Now moving forward, let us see what are the three important components of UHC. Okay, so one is actually accessibility. Okay, so accessibility is what everyone who needs this particular health service should actually get them. Okay, and not only those who pay for them. Okay, so if I'm a person who is not able to pay for any kind of health services under UHC, I should also be given this particular this particular liberty. So this is what is accessibility. Next one is affordability. Okay, so this is nothing but I have to be protected from any kind of financial hardships. Okay, so people should not fall into the trap of debt by paying for their health. So this is what is the affordability. And finally, it is the quality of the services. Okay, or you can say equity. So this is what it is. That is, services should be very much adequate as well as effective. So these are the three important components of universal health coverage. Now let us move forward. If you see, why is this particular universal health coverage important for India? Because the first and foremost is that there is much of the out of pocket expenditure. What do you mean by out of pocket expenditure? That is how much a person spends from their own pockets in order to get a disease treated, is called the out of pocket expenditure. So as you see in India, as per the National Health Accounts NHA 2021-2022 data, around 40% of India's total health expenditure actually goes out for out of pocket expenditure. Do you understand? And then if you see, there is catastrophic health expenditure. What do you mean by this? The financial distress that people have because of this health expenditure is too much in India. For example, if you see, according to the WHO, 17% of the Indian households incur catastrophic health expenditure, and this actually exceeds 10% of their total household budget. This is what they say. Next, if you see, there is a lot of regional disparity in terms of accessibility, and it is not equitable is what they say. So rural India is actually mainly disadvantages when compared to that of people who live in urban India. Okay, but 33% of, this is what it says, rural India is at a disadvantage. Okay, here rural India is a place where 65% of the population actually stay. Okay, but it has only 33% of the healthcare resources. Then if you see burden of the diseases, so India actually bears the brunt of both the communicable as well as the non-communicable diseases. So you need to know what are communicable and non-communicable diseases. And as per the Global Burden of Disease Study 2019, NCDs, non-communicable diseases like the cardiovascular diseases, etc., that actually contributes to 66% of the total deaths in India. So now we've actually seen what is the necessity for integrating tuberculosis into the UHC. For that, we need to understand what is UHC. We actually saw that people have access to quality health services whenever they need, from wherever they need, without causing any kind of financial hardships. And then we looked at what are the different components, okay, that is affordability, accessibility, as well as quality of the services that is provided, or the equity. Then we move forward and we actually look into why UHC is very, very important for India. First thing is that there is more, the percentage of out of pocket expenditure is more, and there is catastrophic health expenditures, particularly in the households when compared to the total percentage of their budgets. Next one, there is inequitable accessibility, or you can say the rural people are actually at a more disadvantageous situation when compared to that of the urban, but rural areas are the ones which actually host around 65% of the population, and also there has been increased burden of the NCDs as well as the communicable diseases. The next one is the gender and socio-economic inequalities or inequities, I can say. So according to the National Family Health Survey 5, it has found out that certain vulnerable sections, specifically women as well as others, that is poor and marginalized sections, specifically from the SC/ST community, or you can take the economically weaker section, actually they bear the brunt of this particular UHC. Okay, so they don't have access to the universal health coverage. The next one is, what are certain barriers in UHC in India? Of course, there are infrastructural barriers. Okay, so if you see, that is the public health infrastructure, that is the doctor to the patient ratio, the nurse to the patient ratio, or the hospital beds with respect to that of the person, with respect to that of the patient ratio. It's very, very bleak, or it is very minute or insufficient in India when you compare that with that of the WHO recommendations. Let's see. First one, infrastructure challenges. So there is insufficient public health infrastructure. That is, there are 0.5 public hospital beds. Okay, so government hospital beds are only 0.5 per 1,000 people, whereas WHO recommendation is at least 5 beds per 1,000 people. Next one, there are rural healthcare deficiencies. For example, especially during emergencies, there is poor connectivity, or poor accessibility, or poor transportation. This is what is a problem, because so many times in news you see, due to the lack of ambulance, what happens, the father actually carries the cadaver of the diseased child. Okay, so this is what is the the plight of India. Next one, the financial challenges are there. Of course, the low public expenditure on healthcare. If you see, 1.28%, only 1.28% of the GDP is actually spent on health. Okay, so this is as per the data from the Economic Survey 2022-2023, whereas the WHO recommendation is around 5% of GDP. And also, as I told you, there is higher out-of-pocket expenditure. Okay, so this also worsens the health status of the people who cannot afford. Next one is the human resource challenges. I told you, right? How many number of doctors do you think are present per 1,000 patients? Only 0.7, not even one. Whereas the WHO standard is one doctor at least should be present for 1,000 people. Also, if you see nursing staff, it is only 1.7 nurses per 1,000 people, whereas WHO recommends at least 3 nurses per 1,000 people. And also, there is unequal distribution of healthcare workforce, where 74% of the qualified doctors cater only to the urban areas, right? And here, this is actually home just to 35%, because if you see, the rural areas actually have 65% of the population over there, but then it has only 33% of the services, whereas it's almost reverse in case of urban cities. You can say the urban places, where there are 74% of the skilled doctors, that is the resources, where only 35% of the population actually resides. Okay, so these are also few of the barriers of UHC in India. Next one, definitely the governance as well as the implementation challenges. There are a lot of leakages as well as corruption that actually takes place in the welfare or the health schemes. Okay, so Transparency International in 2021 survey, it has actually found out around 40% of the public users in India take bribes for the healthcare services. Next one, that is they give out bribes, okay, in order to access the healthcare services. And there are also issues of transparency as well as accountability in allocation, okay, as well as utilization, auditing of the healthcare funds, okay, and this causes a lot of public trust. It actually has an impact on the trust as well as the efficacy of the healthcare system in India. So these are few barriers of UHC in India. So in order to cater to this or to address this, the government has come out with various policies. One such is the National Health Policy of 2017. Let us see what is this. It actually has key principles such as equity, affordability, universality, as well as it has to be a patient-centric quality care. And also, whatever goes wrong or whatever goes right, the system actually has to be accountable, and also should have inclusive partnerships, pluralism, as well as decentralization. The next one, the National Health Policy focuses on providing preventive as well as promotive healthcare in all the developmental policies. Next one, access to quality healthcare should be given. Of course, it is one of the principles of UHC without having any kind of financial hardships. The next one, the National Health Mission, that is the NHM. This actually provides supports to the state governments in delivering the accessible and affordable healthcare to through two submissions. Okay, what are the missions? One is National Rural Health Mission, NRHM, which focuses on the rural areas, of course, and the next one is the National Urban Health Mission, that is the NUHM, which focuses on the the urban areas. Okay, now let's move forward and see what are the four mission mode projects under the Ayushman Bharat. The first one is this one, okay, PM Abhi, that is nothing but the Prime Minister Ayushman Bharat Health Infrastructure Mission. Okay, so this is nothing but it is a centrally sponsored scheme with an outlay of 64,180 crores. Okay, so this actually aims at promoting primary, secondary, and tertiary healthcare systems, or it strengthens. The next one is to enhance the capacities for the detection and the treatment of new as well as emerging diseases, and also the final target or the objective is to improve the existing institutions or to create the new ones. So this is what it is. So this is one of the four mission more projects under the Ayushman Bharat. The next one, Ayushman Bharat Health and Wellness Centers, that is HWCS. Okay, so here these are sub-health centers or the primary health centers which are there to deliver comprehensive primary health care, and it includes the services such as being preventive measures or also rehabilitative measures, the curative care for the reproductive as well as the child health, communicable, non-communicable diseases, etc. And also the what do you say, these health and wellness centers are also called as Ayushman Arogya Mandirs. Okay, so this is what it is. Recently we actually saw that as well. The next one is Pradhan Mantri Jan Arogya Yojana. Okay, so here you need to know what is this National Health Policy of 2017, what is the National Health Mission, under which you have four missions, what are the four different missions is what you need to know. Okay, so Jan Arogya Yojana is the next one, that this actually provides health insurance coverage to all the citizens who are eligible under the scheme, and this actually reduces the financial barriers. And next one is Ayushman Bharat Digital Mission. This was asked in your prelims examination. It's a PYQ. So this was actually launched in 2021 in order to create an integrated digital health infrastructure, and this also aims to bridge the gaps between the or among the healthcare stakeholders. And this actually how it is done, it provides the health cards and it actually builds the digital highways, okay, for seamless healthcare delivery. Okay, so these are the mission mode projects under this Ayushman Bharat. And so what is the way forward? Of course, as the WHO recommended, you need to increase the percentage of expenditure that is spent on health. So it has to be increased from 1.28%, that is current expenditure, to at least 3 to 5% of the GDP. Okay, so this is what it is, and also it has to be supplemented by the private sector participation through the CSR contribution. This is nothing but the corporate social responsibility. Okay, next one, that's what I told you, PPP. This is for has to be done for improvement in the healthcare infrastructure, followed by that strengthen rural healthcare delivery. Okay, so you need to focus on the infrastructural development in the rural areas, also telemedicine, okay, where you can contact the doctor over phone. And next one, incentives for healthcare professionals to serve in the rural areas, because most of them are very reluctant to go towards the rural areas. Next one, accelerate digital health integration. We saw this, right, through Ayushman Bharat digital mission. We need to focus on improved efficiency in health management. And finally, there has to be accountability. A robust accountability framework has to be established in order to monitor how the processes are actually taking place. Okay, so this is what is about the universal health coverage. Now, the second article speaks about imagining a 360-degree and comprehensive TB care response. So in this particular article, we will be exclusively discussing about tuberculosis as a particular disease. Okay, as you know, diseases actually become very important as a part of your general science. So here it is important for prelims as well as the mains examination under paper 2, issues relating to the development and management of social sector services relating to health. So this is what it is, and others are education as well as human resources. Now if you move forward, if you see a PYQ in 2013, there has been a prelims question with respect to the transmission of the diseases, okay, from a person to person, okay, or you can say from one person to another through tattooing. Which of this can actually be spread? So how is the spread of a particular disease, whether it is a zoonotic disease or not, which pathogen actually causes it, whether it's a bacteria, it's a virus, or what it is very important. Okay, so in that manner, you know, tuberculosis is very important. So there are multiple articles that I have actually combined in order to bring out one particular article. 1 minute, let me just see. Okay, so let's continue. So there are multiple articles with respect to the progress India has made with that of tuberculosis. So we will see that quickly because we've discussed this multiple times. Okay, so India actually follows what is, I told you, right? There are vertical models or the vertical initiatives for specialized diseases. Okay, so for example, the National TB Elimination Program was actually the program under which the tuberculosis care was taken care in India. Okay, and also under this there is this particular approach, that is one size fits all approach that India actually follows. But this article says that it has to be patient centric approach in order to cure this TB or eliminate TB as target set by India. Okay, so this is what it is. So before discussing it further, let's see what is tuberculosis, whether it's caused by virus. Okay, no, it is actually caused by a bacteria that is called as Mycobacterium tuberculosis. So an infected person or a person who is infected by this particular bacteria, Mycobacterium tuberculosis, sneezes or coughs, what happens is that there are tiny droplets, okay, that actually gets diffused into the air, and when another person inhales it, then that person also contracts this particular disease. So it's a bacterial infection that is caused by inhaling tiny droplets from the cough or the sneezes in, or when an infected person sneezes. So it is caused by Mycobacterium tuberculosis that belongs to this Mycobacteriaceae family, and TB is supposed to be the 13th leading cause of death, and it is the second infectious killer after COVID-19. Okay, very important. And so this is above HIV as well as AIDS. Okay, so it is TB. TB is actually the 13th leading cause of the death. Next one, the transmission to the people, it happens to person via air, and this is what is actually given in this image also. Okay, so cough with sputum and the blood at times, it actually causes chest pain. These are the common symptoms, and also weakness of the body. There is actually weight loss, and then you have fever as well as night sweats. Okay, the transmission happens from person to person. When they sneeze or when they actually spit, they what to say, diffuse or they release the germs into the air, and when another person inhales it, they can actually get infected by this particular disease. Okay, so now let us actually move forward and see what are the different kinds of tuberculosis. If it specifically affects your lungs, it's called as a pulmonary TB, whereas other parts it's called as the extrapulmonary tuberculosis. Whether it's treatable and curable? Yes, it is treatable and it is a curable disease. So far, is there any kind of vaccine that is present for TB? Of course, the BCG vaccine, which is called as the Bacil Calmette Guerin. This is the only licensed vaccine in order to treat this particular disease. Okay, so here BCG actually works. Here you can see the uniqueness of this particular drug or the vaccine. BCG works well in only certain geographical locations and not so well in the others. For example, the farther your country is from the equator, the efficacy or the efficiency with which this particular vaccine works is very, very high. Whereas, like if you see the countries like UK, Sweden, Denmark, in all these countries, the efficiency of this medicine or the vaccine is very, very high. Whereas if you see the countries just above the equator, like you can see certain countries like India as well as Malawi, and then you see Kenya, here the efficacy of the vaccine is not very high. Next, there is also this drug resistant TB, where this particular TB bacteria, that is this mycobacterium tuberculosis, no more is resistant to this, it is no more killed by this particular drug. Okay, so that is what is called as drug resistant. The bacteria actually becomes totally resistant to drugs. Resistant to drugs. So this is what is called as the drug resistant tuberculosis. Now let us actually move forward and see what is the status of India's TB burden. So there are, or you can say there are reports, for example, India TB report of 2024 as well as the World Health Organization's report on global TB 2024. According to this, let us actually see what are the key observations of this report. So there has been decline in the incidence of TB, okay, and the TB related mortality in India. Mortality means the number of deaths that this particular TB causes. So this has actually dropped below 200 per lakh population. Okay, so in 2022 and 237 per lakh in 2015. So in 2015, if you actually see, the TB incidence was 237 per lakh population in 2015, and now it has actually decreased by this 37 and has become 200. This is nothing but a 16% decline. Next one, the mortality rate is that it was actually 18%. It has seen an 18% decline from 2015, and currently if you see, it is only 23 per lakh in 2022. Then if you see the improvement in treatment success rates, I told you, right, there are different types of tuberculosis. So there are different types of improvement in the treatment success rates. For example, the treatments which are used in multi-drug resistant TB, that is MDR TB, here the success rate increased from 49% to 74%. Then if you see the pre-XDR TB, which is actually resistant to the fluoroquinolones. So here the success rate is has actually increased from 34% to 68%. And finally, extensively drug resistant TB, where the success rate remains low at 45% in 2021. So it actually shows that there has to be a further improvement in this particular area. Okay, so these are the success rates in different types of drug resistant TBs. Okay, but don't confuse this with the different types of TB, that is pulmonary as well as extrapulmonary. Here the bacteria actually becomes resistant to different drugs or to one particular drug. Based on that, it is classified as multi-drug resistant, then pre-XDR resistant TB as well as extensively drug resistant TB. Okay. Now moving forward, what has been the performance of Indian states in TB control in India? So Odisha, if you see the score for 100 is actually 93.5. Okay, so this is the top state, followed by Gujarat as well as Maharashtra, whereas the states that require improvement are Bihar, Karnataka as well as Punjab. And also there are challenges in the financial burden as well as the health coverage that we already saw, right? The catastrophic expenditure or the catastrophic healthcare spending is actually there in India, where 10% of the India's population faces this healthcare spending, and this is the third highest among the 14 lower middle income countries with high TB burdens. Okay, so this is third highest among the other 14 countries which actually suffer from higher financial burden. Next one, what are the global initiatives of TB? See, I will run you through this particular thing quickly, because the objectives, the aim, the targets, all that is very, very important, but at the same time it's lengthy as well. Okay, so here you can refer to these in the notes that will be provided to you in the Telegram group, then also from our website. So first initiative is Global Fund. Okay, this was actually designed in order to support diseases apart from TB. It is also malaria as well as HIV. Okay, so human virus, you know this, right? HIV, TB as well as malaria. It is the single largest channel of additional money for global TB control. Next one, Stop TB Partnership, which has around 1,500 partner organizations, which include the NGOs, the international organizations, and the government organizations. Okay. Next one is Global Plan to End TB 2023-2030. This actually maps out how to end TB as a public health, which actually focuses on what is the need to invest in new TB vaccine and get it approved by 2025, and also how to mobilize global investments of up to $250 billion for the diagnosis and treatment of this particular disease. And also, you know, the SDG goal, that is SDG 3.8 actually talks about universal health care, and 3 talks about health. So this is what you need to know. Now moving forward, what are India's initiative? This is very, very important. First one is Pradhan Mantri TB Mukt Bharat Abhiyan. So this is actually by the Ministry of Health and Family Welfare. And here the objectives are what? To provide additional patient support in order to improve the treatment outcomes. Next one, to augment community involvement also in order to end TB by 2025. Next one, you have to bring in CSR. Here as components, it actually has the portal, that is the Nikshay portal, which is a platform for community support for the persons who are suffering from this TB. And also it has Nikshay Mitra initiative. This actually ensures that there is additional diagnostics that is given, and also nutritional support and vocational support for the TB treatment. The next one is Nikshay Poshak Yojana. This is also a centrally sponsored scheme under the National Health Mission. Very, very important. We've seen here financial incentive of around 500 per month is given for the nutritional support to each notified TB patient. And the next one is National TB Elimination Program. We saw, right? So here it actually focuses on elimination of TB by 2025. That is this particular year, 5 years ahead of the SDG target of 2030. Next one is National Strategic Plan for TB. This is also targeting on ending TB by 2025 in a mission mode. And there are 4 strategic areas, that is to detect, to target, to prevent, and to build. Okay, so this is what it is. Next one is TB Hatega Desh Jeetega campaign. So this is nothing but, it actually has 3 strong pillars. Okay, so this is nothing but, the first one is clinical approach. And here it includes clinical approach, public health component, and active community participation. So all these dimensions become very, very important for your examination. So next one is the article which is on anti-dumping. That is, India imposes anti-dumping duty on 5 products from China for up to 5 years. So here what is important is what is dumping and what is anti-dumping duty. Important for both the prelims and the mains under Indian economy and issues relating to planning, mobilization of resources, growth, development, and employment. Now let us actually move forward and see the PYQ that has been asked in the 2019 mains examination. Here there was question on enumerate the indirect taxes which have been subsumed under GST in India. So these kind of financial instruments, or what do you say, what do you mean by taxes? What do you mean by, what are the classification of taxes? The direct tax such as the income tax, corporate tax, and the indirect tax such as the GST, when it came, by which amendment has it come, and also what are the different tariffs, okay, the custom duties, or you can say the excise duty that the government actually levies, what is the trend in that, all that becomes very, very important. So here the government of India through the Central Board of Indirect Taxes and the Customs has imposed anti-dumping duties on 5 products. Okay, so what happens, let me say what is the meaning of dumping. After that we will move into what is this anti-dumping duty. Okay, so here for example, take a country China. Okay, so China produces MI films, right? So here the cost of production or the price of this particular MI phone in China is 10,000. It is just an approximate figure. This is 10,000, okay? But what China does is it exports these MI phones into another country, say India. So when it exports this, the same MI phones which were priced at 10,000, when it's exported into India, it costs 9,000. Okay. So here what happens, since this phone is actually cheaper than this particular the production price, and also this will happen to be cheaper than the domestic production itself. For example, India has Micromax phones. Okay. So here the price of this is actually 11,000. But the MI phone with similar features is actually provided at 9,000. What happened? People will storm towards buying this MI. But after a particular point, when people consume so much of MI and when they are addicted to the services, what happens? They will suddenly increase the price of this MI phone. Okay. So this is where they become advantageous. So in order to cut short this particular, so this process is called dumping, excessive export of one particular product of a country into the domestic economy of another country. So this will actually, what happens, this will hamper or this will cause a lot of impact on the domestic manufacturers, specifically the MSMEs. Okay, do you understand? So in order to counter this, India as a safeguard mechanism imposes a duty that is called as anti-dumping duty. Okay, do you understand? So how it is done? So this is 10,000. This is actually sent into India by 9,000. So as 9,000, so there will be an anti-dumping duty of 1,000 rupees. So that it is 10,000 here and it is 10,000 here. Do you understand? So this is called as anti-dumping duty. Let us quickly read what it is. So dumping is nothing but a country exports a particular product at a price lower than the domestic market price. So the MI phone at the domestic market price, which was 10,000, is exported at a price of 9,000. Okay, or the cost of production. Okay, so this disrupts the importing country's market. This is called, this is what, this is India's market. This is what it is telling. And anti-dumping duty is nothing but it is a safeguard or a protectionist tariff that is imposed by this domestic country, that is the domestic government of foreign imports, priced below fair market value. The next one, this will level the playing field for the Indian manufacturers. Of course, the other, this one, that is Micromax, will also be sold at 10K, whereas MI will also be sold at 10K. So this is why it provides a level playing field for the products of other countries as well as the Indian products as well. So here the domestic government imposes additional tax on imported goods, and they are which are actually sold below the market price. So for example, country A manufactures a toy car, okay, and the manufacturing price is $75. But this actually exports into or dumps into another country at $50. So what happens? That country will impose an anti-dumping duty of $25. So $50 plus 25 again becomes 75. So thereby provides a level playing field. Okay. So this is what is the concept of anti-dumping duty. So this anti-dumping duty actually follows all the rules or the framework that the WTO, that is the World Trade Organization, actually stipulates. Okay. Next one, it is governed by, that is anti-dumping duty is governed by the Customs Tariff Act of 1975 and anti-dumping rules of 1995, and the investigations into these kind of anti-dumping duty related issues is done by the Director General of Trade Remedies, that is DGTR, under the Ministry of Commerce, and this is imposed by the Department of Revenue, Ministry of Finance. So all these details are very, very important. Now let us move forward and see what are the recent products, that is the imports from China, on which anti-dumping duty was levied by India. So the first one is soft ferrite cores. Okay. So you need to know what this is. Okay. It is, whether it is actually used as chips in semiconductors, whether it is used in electronic devices, you need to know. So it is up to 35%. Next one, this is for 5 years. Next is vacuum insulated flask, again from China. This is 1732 per ton, that is $1,732. This is also for 5 years. Next one, aluminium foil of certain thickness, again up to $873, and then followed by the trichloro, the trichloro, 1 minute, the trichloro cyanuric acid. So this is actually a water treatment chemical, and this is actually imposed on both China and Japan at the rate of $276 to $986 per ton. and this is also for 5 years. And the last one is PVC, okay, that is polyvinyl chloride paste resin. This is also from China, from 89 to $707 per ton, and this is also done for 5 years, okay. So now what are the broader implications? So for India's trade policy, if you see, India is actually suffering with a lot of geopolitical tension. So this is actually seen as a cautious move in order to counter the dumping that China actually does, okay, and in order to counter the trade imbalances. Do you understand? So next one, this aligns with the push for Atmanirbhar Bharat. This is nothing but self-reliant India, and also indigenous manufacturing, that is make in India, by protecting the vulnerable sectors. And also it is going to be a huge relief for the domestic manufacturers, especially the MSMEs who face the margin pressures due to cheaper imports, okay. So this is what it is. Now let us actually move forward. It is the last article for the day. Migration after COVID, most of which I've actually told you during our discussion itself, right? So here, urbanization, reverse migration and foreign remittances, we will see what have been the change in the patterns. So this is important for both the prelims as well as specifically the mains examination under rural economy, unemployment as well as inclusive growth, okay. So pre-COVID, what had happened? So imagine these are the rural areas and here are the urban areas. So usually what happened, in search of improvement of better standards of living or quality of living or better opportunities in terms of employment, etc., people actually moved from the agrarian economy, that is the rural areas, towards the urban areas. So this actually happened before the striking up of the COVID-19 pandemic, but post the COVID-19 pandemic, there was a reverse migration patterns, that is people started moving back from the urban areas to the rural areas because of loss of job, because of inadequate healthcare services, and then because there was actually curfew everywhere, everything got shut down. So the lifestyle of people suddenly actually changed and it got hit by this particular pandemic. And also now post COVID, what happened, there has been return to the earlier trend, that is people are now again migrating from the rural areas to the urban areas. So this is what they are saying, and it is also seen that people generally go towards the developed countries like the United States and Canada, etc., but now people are also moving towards other countries in the Europe, okay. So let us actually see what are the patterns that is actually observed. So if you see, in the previous year in 2017, there was a question with respect to the DPSP 42nd Amendment of the Constitution. So participation of workers in management of industries, right to work and assistance, securing living wage and human conditions for the workers, specifically with respect to migration and the people, their wages, etc., has been asked. This is how you actually have to link this topic to the PYQ. So next one, if we see, the article actually analyzes the internal and the international migration trends in India, specifically in the last 5 years after the COVID-19 pandemic, okay. So let us actually quickly see. So the migrants actually moved back to rural India during the lockdown, I told you, right? And now they are immigrating back to the cities. These are because of the urban pull factors, that is employment, better health services, etc. But India lacks sufficient welfare schemes or data regarding the migrant workers, okay. Because even if you see, the census which provides the basic data got delayed in 2021. Also if you see the PLFS, okay, the labor force participation, this survey also was actually during 2020 only. So here it could not provide us a trend or the longer migration trends, okay. So this is what is the condition. Now if you see, reverse and return migration. So during the pandemic, there was a reverse migration due to the job losses and lockdowns, okay. Around 70 million people had gone back to the rural areas, and then the low skilled laborers actually faced a lot of wage loss. There was a lot of food insecurity, there was discrimination and loss of access to health as well as education. Next one, now the migrants have returned, that is the urban area, they have come back to the return, right? They've come back to the urban areas due to agriculture distress in the rural areas, and then because of disguised unemployment. So you need to know what are the different kinds of unemployment, okay, and what do you mean by disguised unemployment, okay. So this is what you need to know. Next one, what are the key highlights? There are rural push, that is, there are factors in the rural areas that push the person towards the urban areas, and there are certain factors in the urban areas that pull them towards themselves, okay. So even if you see, the MG Narega programs actually offered only little seasonal rural employment, and also there was persistent rural urban inequality, urban aspirations, which actually drove back these people, or they migrated back to the cities. And also, if you see, 40% of India's population is believed to be occupying the urban areas or the cities by 2026, and this is by the aspirational programs like the smart cities mission that the government is taking up, okay. So now let us move forward. Let us see the current scenario in international migration. So there have been severe problems of Indian migrant laborers because they are facing a number of job losses. That is, now the focus is on the high skilled laborers, whereas lesser focus is given on the daily wage laborers, okay. So here there are job losses, poor healthcare, and then there are wage cuts also during the pandemic. It actually took place. Next one, the resilient remittances. However, they lost the jobs and other things. The remittances that actually flowed here on the dependent families in India, it actually showed some resilience, okay. Next one, the migration to the Gulf countries were very, very strong, and you see, I told you the higher skilled laborers were high in demand, and they were actually seen to be migrating towards European countries, and also they all were found going to the non-traditional destinations like the Malta, Georgia, Cameroon, etc. And student migration also surprisingly increased, okay. For example, Kerala student immigration actually doubled from 2019 to 2023. Now, there are gaps in the welfare schemes and the governance, okay, with respect to that of what government actually offers specifically for these people or the migrants. That is, the first one, e-Shram portal. So here what happens is that the e-Shram portal is actually launched to register the unorganized workers, and this is actually hindered, okay, by low awareness and digital gaps. The portal is there, but people are not aware of such a welfare program. Next one is One Nation, One Ration Card. So this aims to ensure food security for the migrants, but then many remain excluded from this. And also the government frameworks actually requires a lot of reform. They have to be evaluated and they have to be effectively implemented, okay. So this is what is the article actually talking about. And what is way forward? I already told you, right? The delayed census have to be conducted at the earliest, so that it provides more realistic data on the migration population. The second one is that the existing data is nothing but what we get from PLFS 2021, that is specifically during this period of COVID, where you cannot rely on that, is what they are saying. And also the Ministry of External Affairs emigrant data is likely underreported, okay. So we need to follow the model that has actually been taking place in Kerala, okay. So Kerala has something called as the Kerala Migration Survey that is actually conducted after 5 years, okay. So this has been in place since 1998. So we need to actually focus on programs like this or initiatives like this, taking inspiration from the states which are doing better for better migration governance in India, is what this particular article says, okay. Now let us quickly solve a mains question. India's aim of achieving UHC, that is Universal Health Coverage, faces multifaceted challenges. Discuss these and suggest practical measures to overcome them. So what do you mean by universal health coverage is what you will start off with the answer. This aims to provide quality health care to all the people without facing any kind of financial hardships. And India faces challenges with respect to infrastructure, financing, and the the governance, despite the schemes like Ayushman Bharat. Let us see what are the challenges that India faces. Of course, they actually face the infrastructural challenges, and also the out of pocket expenditure is very, very high in terms of equity, in terms of affordability, accessibility, as well as there are number of governance issues like leakages, corruption, etc. So all this is discussed over here. And with respect to human resources also, the doctor to patient ratio, the nursing staff to the patient ratio, etc. Okay, and the beds also against the WHO recommendations you need to mention. Then what can be the measure? There can be increased expenditure, percentage of expenditure that is actually spent have to be increased from the current 1.28% to 3 to 5% as suggested by the WHO. Next one, improve governance, and you need to increase the efficiency, the transparency, as well as the community monitoring. Now finally, you have to say in the conclusion, a multi-pronged approach which is technology driven and an inclusive approach is very, very critical for achieving the universal health coverage in India. So this is the structure of your answer. Now moving forward, let us quickly solve the MCQs which were a part of DNA, yesterday's DNA. So with reference to tuberculosis, consider the following. It is caused by a protozoa. Oh, I'm sorry. So this is a prelims practice question that is for today. So these questions with respect to tuberculosis, anti-dumping duties in India, as well as the trends in the migration after COVID-19 pandemic is something you guys have to solve on the website in order to know your your absorption from this particular lecture. Okay. So the website link is actually provided in the comment section below. Now, let us move forward to the questions that have been discussed in the previous DNAs. Okay. So, with reference to the GM crops, consider the following. So, genetically modified crops are developed to improve the resistance to pest diseases as well as environmental stresses. Yes, this is correct. In India, cultivation of GM crops is prohibited except for the BT cotton. Is this correct or not? The next one. So in India, cultivation of GM crops is prohibited except for BT cotton. Yes, it is correct. GM crops are generally considered to be environmentally benign with minimal impact on biodiversity. What do you mean by benign? They do not affect much. They do not impact the biodiversity much is what this article, this particular statement says. So this is wrong. And the approval process for the GM crops in India is overseen by the Genetic Engineering Appraisal Committee. Yes, this is correct. So 1 is correct, 2 is correct, only 3 is wrong. So 1, 2 and 4. So here your answer will be B. Okay. So now let us actually move forward to the next one. With reference to the IORA, that is Indian Ocean Rim Association, consider the following. It focuses on promoting open regionalism in areas such as maritime security, blue economy, as well as climate resilience. Yes, this is correct. It comprises only the coastal countries of the Indian Ocean region that are members of the United Nations. No, this is wrong. Not only the members of the United Nations, even others can actually be a part of it. So India is a founding member. Yes, this is correct. So 1 and 3 again are correct. Here the answer is C. Now moving forward, the last question for the day. With reference to the NIRF ranking, okay, institutional ranking framework, which of the following parameter has the highest weightage? So these kind of ranking parameters or any kind of indices or reports which actually uses certain parameters for their calculation is very, very important. Okay, so here research and professional practice, graduation outcome, outreach inclusivity and perception. Which has the highest weightage? Research and professional practice has the highest weightage of 30%. Okay, so this shares this 30% with teaching as well, and the least is perception, which is 10%. Okay, so since A is the right answer, your answer will be option A. Okay. So now with this, we've actually come to the end of our daily news analysis. So for more such videos as well as live sessions, please do like, share and subscribe to Narayana IAS Academy YouTube channel. Thank you, and I will meet you again in yet another live session soon. Thank you.